For many of us in North Wales, this feels very much like Groundhog Day, and as though we are absolutely going right back to square one. We've got the same interim chief executive that was appointed on the day that special measures were initially imposed, almost 4.5 years ago, almost 5 years ago now. We were told by Simon Dean at that time that there were 100-day plans to turn around the fortunes of this failing organisation. We saw no improvement. We've seen over the past 4.5 or so years an organisation which has had even worse performance, record worse performance. It's the worst now in the whole of Wales on many performance measures, and it's got a governance system which is absolutely broken. It is not working. We saw a report which came into the public domain just over a week ago, which had not even been shared, a report which was identifying serious failings in mental health services, particularly in terms of psychological therapies by Together Better, which was not even shared with the chair of the Health Board, in spite of being in the possession of the Health Board for many months. So the system is broken. You're part of the system. This is an organisation in special measures. Can I ask you, Minister, do you accept now that special measures under your regime in Wales do not work, that you are not able to secure the sorts of improvements that the people of North Wales deserve to see in the performance of the Health Board? It's quite clear that Gary Doherty was not up to the job, as nice a man as he was. He was leading an organisation with a team of executives, some of whom were not up to the job, and frankly, we've been glad to see the back of. We need a new team. We need an approach which is going to drive improvement forward. I'm not convinced, frankly, that you're the minister that's going to be able to deliver the improvement we need to see. And I seriously do think now it's time for you to consider your position as Health Minister in order that we can turn a page in North Wales and get a decent level of service for patients in the region. We're going back to square one, and frankly, after 4 and a bit years,